Hi, my name is Dr. John Saltero, and I want to walk you through Cushing's. So Cushing's is hyperactive adrenal disease or hyperadrenocorticism. So when we get that fight or flight response, when we are heading over the roller coaster and we get that adrenaline pump, that's what Cushing's is, but it's kind of all the time. So imagine constantly being in fight or flight. Clinical signs are going to be uh, increased drinking, increased urination, excessive amounts of wanting to eat. They're going to start losing a little bit of fur, especially around their abdomen or the side flank area. And they're also going to lose fur around their tail, almost to the point where it looks like there is no fur, and sometimes we call that a rat tail. So they pant a lot, they are very anxious, so when I see them in the exam rooms, typically they won't stop panting the entire time. How to diagnose Cushing's. So Cushing's is diagnosed through an ACTH stimulation test or through dexamethasone suppression test. Typically, I would recommend starting with an ACTH stimulation test because the time it takes to do the test is about 2 hours versus the dexamethasone suppression test, which typically takes about 8 hours. How do we treat once we've got the diagnosis of Cushing's? Typically, we will treat with trilostane or we will treat with mitotane. So mitotane is typically more reserved for the ones that are actually adrenal dependent. And trilostane, I would say, definitely helps a lot with pituitary dependent Cushing's. So, treatment really just depends on how often we have to go in to get our doses adjusted. Sometimes, especially in the beginning, if we're doing mitotane, it'll be we'll do a test in about 5 to 7 days after starting the mitotane to see kind of what levels we're at, and then usually we'll reduce the dose from kind of once a day to about 2 to 3 times a week, depending on where we're at. And as far as trilostane goes, typically we'll have you come back in about a month and take another blood sample, make sure that we're kind of heading in the right direction, or at least we are kind of in the zone that we want to be in to maintain a normal cortisol level in the body. On the flip side of that, we don't want to overdo it because then we will end up with something called Addison's, and Addison's is the opposite of Cushing's. So sometimes we'll need treatment for that if we go overboard. But typically, if we do the testing correctly and we kind of monitor, I would say your pet should have no problems with the medication, tolerating it, and hopefully living a full and good life. Anyway, thank you for joining me on our journey through Cushing's. I hope you have a wonderful day, and we'll see you back soon.